Welcome back, everybody. May I ask Dr. Yadnik to please chair this session? We will be discussing the sunshine vitamin or vitamin D. The outline of this session is Dr. Ashish Babhulkar and Dr. Lily Joshi will give talks, after which there will be a panel discussion comprising of Dr. Yadnik, Dr. Uday Fadke, Dr. Manisha Patwardhan will join the discussion, and of course, audience participation is appreciated. So I please call upon Dr. Ashish Babhulkar to give the first talk. Dr. Ashish Babhulkar is the founder president of Shoulder Society of India. He has his own clinic and is also attached to various hospitals like Sancheti and Deenanath Mangeshkar Hospital. Dr. Ashish Babhulkar.
Good morning, Golwilkar sir. Thank you for this invitation. I probably stand out like a sore thumb amongst all the physicians here, but I think this just reinforces the fact that vitamin D is replete in the body and represents a lot of issues that are debatable today. And that's what I was talking to Lily Joshi madam, that what fascinates me more is the non-skeletal manifestation of vitamin D, which is really fascinating. But so I shall restrict myself. Manisha has changed a lot of my presentation because she said I need to touch on some of the biochemistry as well, and so we'll see how it goes. The most hey online hello on it see probably the most commonly investigated vitamin molecule in the body with more than 25,000 articles since 2000, and it is really unfair to vitamin D to suggest that it has to do with skeletal health and restrict its research on musculoskeletal body as such. In the body it is omnipresent. In fact, the receptors of vitamin D are found in diverse organs across the body, and so we are coming to see a lot of non-skeletal manifestation of vitamin D, or the role of vitamin D played in regulation of diverse etiologies, right from diabetes to psychiatric problems to gut resorption and so many other things. And it is another valid point that I would like to mention here, that lack of sunlight is affecting all of us in a tremendous manner, and we don't realize the impact of it. It is again a disservice to imagine that our food supplementation will overcome the lack of sunlight. Just a very sketchy diagram I put up, but I think this represents the impact of vitamin D very nicely across the body, where it affects everywhere, including diverse etiologies like cancer, like kidney function, like the malabsorptions, to control of diabetes, pancreas resistance to sugar, and of course we know that the skeletal health, osteoporosis, fractures, fall prevention and such things. So just to quickly take you back to the basics without having to go into the nitty-gritty and bore you with didactic details, the skin has 7-dihydrocholesterol, which will get converted by UV rays into because of the UV protons into vitamin D3. The same on diet, where ergosterol is more commonly found in the food supplements, get absorbed in the gut and then ultimately gets transferred by chylomicrons through the gut into the liver, where it gets converted to 25-hydroxy vitamin D3. And this further then goes down to the kidneys and gets converted to the active form of 125 dihydroxy vitamin D3. The vitamin D receptors are practically found in every cell in the body. Cell integration is a function of vitamin D, but apart from that, the vitamin D receptors are profusely found in kidneys, in muscle tissues, neuro cells and such things. It's a complex interaction between three main organs: the parathyroid, the intestine and the bone. So the bone has the biggest source and storage of the calcium and phosphorus, and that's why vitamin D regulates the levels of calcium and phosphorus by a very complex interaction between the parathormone, calcitonin, bone and intestine axis. Most of you are aware of that. I don't think I am the expert to go into that, but there are three very typical scenarios where you have a low calcium normal phosphorus, or a normal calcium low phosphorus, or both calcium and phosphorus low, And all of these three impact the parathormone differently, presenting diverse case scenarios. In terms of source, there is no good dietary source for vitamin D. Fish is supposed to be, but you would need to eat it in kilos, which probably to our culture is not a common source of vitamin D. The Western countries fortify their food significantly to offset the loss of vitamin D from sunshine that we don't get. But sunlight remains the primordial source of good vitamin D, and there are a lot of factors that impact the conversion of vitamin D because of sunlight. The time, the age of the patient. As you grow older, you tend to convert less of vitamin D. The season effects, winter sunshine is not good because it's not adequate enough to convert because of the oblique UVB rays, not enough to convert the skin 7-DHC into vitamin D3. Our skin pigment itself dictates how much of sunlight can convert a substantial part of the vitamin D and which part of the world and globe you stay in. So, anybody north of 45-degree latitude is just not going to get enough vitamin D from sunlight. Is the most efficient provider of vitamin D, and then there is this conventional myth that patients come and tell you that Covalone is adequate for me and I have been going out in the sun. It doesn't do anything, it doesn't even scratch the surface. You need to be out in 11 to 1 and without having to wear burqa and long shirts and trousers, and don't expect that मी तर रोज ऑफिसला 11 वाजता जाते and 12 वाजता येते. It doesn't count. So, we need to make a very focused objective effort to get that sun to convert the skin 7-DHC. Excessive sun exposure will never ever cause intoxication. That's another myth that has been. Australia was one of the first countries to offer a vitamin D program, and then they started getting a lot of skin cancers, and so they started the slip slop slap campaign of putting in all these creams, and they went down from a good healthy state to a vitamin D deficient country. So, that is another thing. This is one interesting study I would like to put to you. Tagawa in Japan, very high up north, they did an Alzheimer's prevention intervention study, and amongst 243 patients, they gave one section 10 minutes of vitamin D daily for 241 days. The other section got only 15 minutes in a week, and 70% of them did not get any vitamin D. They found that the number of falls had reduced, the fractures had reduced, their vitamin D levels were checked, and they went up from 24 to 52.2, whereas those on the other group where there was no intervention did not change at all. So, people are contesting the role of vitamin D, lack of research, lack of literature. There is enough there if you search and scrape the barrel. There is a lot of evidence to say. This is another source where you have seen from the Clinical Endocrine Journal, where you see that the graph of the availability of sunshine in the different months and going down in testing on the bottom layer the plasma vitamin D levels. And you will see that if I get exposure to sun today, within 6 weeks that converts to vitamin D levels. So, as the sun rays go down, the vitamin D levels go down proportionally on this. So, coming to my focus branch on musculoskeletal implications, we know about osteomalacia, osteoporosis, and there is no need to spend enough time on that. But what bothers me and my patients is a huge amount of muscle atrophy, especially select muscles, that is because of vitamin D deficiency. We see a lot of neuropathy, clinical and subclinical, and autoimmune diseases are well known because of vitamin D deficiency. But I see a lot of problems with post-op pain. Pain itself has a lot to do with vitamin D deficiency, and amongst all the epileptic patients that we check, all of them have had levels of vitamin D less than 10 straight away. Fractures are well known in vitamin D deficient population, last 3 slides, but very often as surgeons we operate those patients, get them going back home, we fail to intervene with their vitamin D levels, and they come back in 2 years later with other fractures of osteoporosis related.